Access to reliable ambulance service is a problem in rural America, and it's a problem residents in Pickens County are all too familiar with. Getting patients to a hospital has been a struggle since Pickens County Medical Center shut its doors in 2020. Grace Brister was in Pickens County today to speak with leaders about efforts to improve emergency response, and she joins us live in the studio. Grace, what can you tell us?
Winston, leaders across Pickens County believe that an ambulance service is a basic right for their citizens, and that belief has them working together to find a solution. After struggling to get patients to and from the hospital over the past 4 years, county leaders have worked out one aspect of getting reliable ambulance service: a revenue source. Under the plan, one unit operates 24 hours a day, another provides 16 hours of service, allowing more than one ambulance to be on duty in the county.
Every patient in Pickens County that calls 911 must be transported out of the county to another county for hospitalization.
Edgar Calloway, the operations director for EMS in Pickens County Ambulance Service, says having 2 ambulances is critical for citizens.
I can't even explain how critical that piece of it is, because when one ambulance is gone, if somebody gets sick, there's nobody to respond. You really probably need more than 2, but certainly 2 is almost a minimum.
Mayor Mickey Walker of Carrollton says he sees the need for the service every day, and this ensures there's another ambulance ready to go when one is occupied.
This morning we had a wreck right out on 86 toward Pickensville that had an ambulance tied up for probably an hour and a half. During that hour and a half, if somebody else would have called, we had no help for them.
The cost of this service is $330,000 a year. Part of the funding will come from municipalities, and the other funding will come from the county. Manager of the Pickens County Ambulance Service, Vicki McCrory, says she knows this won't fix all the problems, but it will help, and they're working to get the staff back up to par.
With the subsidy also came raises that will get us back up to our neighboring county pay scales, so we'll be able to compete with other counties.
Walker says ideally they'd like to have the emergency room open again, but that would not be an easy or quick process.
I believe even if we had the money right now, the time frame would be a year to 2 years. Our senators and representatives, which are in session right now, are battling to try to get us some funding for that. We've got to get this health care done first. I know that exporting stuff out of Mobile is important. Our lives are important up here. We've got to get this funding, and that needs to come first for all these hospitals struggling.
The tax fund budget for the Pickens County Ambulance Service will take effect on April 1st.